exercises that one can do, and how long would it take to see improvements?
So for metabolic health to improve, the diet is for Indian, it's high protein diet, more of fibers, less direct or refined carbs. It should be more of a complex carbohydrate, and overall fat, particularly fried fat, is to be decreased. The saturated fat is to be decreased, and definitely it improves. But exercise, one is regular physical exercise, which is physical activity to become more physically active, going for regular walk, aerobics, but muscle strengthening, that helps. And then regular some exercise related to abdomen only, that's abdomen stretching, yoga, doing some abs, that will also improve the fatty health.
So I would like to ask you that when we talk about diabetes, then people think of heart issues or the kidney failures or issues with the eyes, and they link it with diabetes. But sometimes liver issues get unnoticed. And when 70% of the people might have type 2 diabetes and have fatty liver, and how is it different from other complications?
So I fully agree what you are saying. And whenever we talk of type 2 diabetes, we talk of cardiovascular disease. We relate it with kidney problem, we relate it with eye problem. But many of our type 2 diabetic patients have fatty liver disease, and which is completely unnoticed by primary care physician. The general awareness about the fatty liver is very low. But since few years, they send recommendation by different guidelines, and at the same time, medical doctors also recognize and realize the importance of liver health in persons with type 2 diabetes. This can progress, not only a fatty liver progress to MSLD, but even liver cirrhosis, end stage liver disease, or even hepatocellular carcinoma. So it is a time that we talk more about the liver health. And now there are medication which can help us to improve the liver health in a person with diabetes. We get some investigation, and there are some non-invasive marker also by which you can understand what is the liver health. And now we started talking to the patient that the liver is also a very challenging issue in a person with diabetes or even with obesity. Even someone may not be diabetes because it's a part of metabolic syndrome. So that's very, very important. We started talking, and I'm sure Pramila will also agree that we now talk about the liver, but it requires more education, more awareness, because in India there are 100,000 primary care physicians. If all of them start talking about liver health more, probably the awareness will increase more.
But does fatty liver affect diabetes, and does it make it harder to control and vice versa, or it's a one-way street?
So it's a very a link between, I can say, fatty liver, diabetes. They both are part of metabolic syndrome or a pre-diabetes, or someone have only central obesity, visceral fat is high. So this is very closely linked. It's not like that a one disease. It's a full metabolic picture which is responsible, which includes dyslipidemia, high triglyceride. It is all because of less exercise, sedentary lifestyle, more of our food habits that increases or be prone to make you more risk of developing diabetes or even with cardiovascular disease also. So persons with fatty liver also having a high risk of developing heart disease too.
So, sir, if a person has diabetes, does that mean that how would he know that if he has a fatty liver issue? And what are the
So
things he should look out for?
I mean, first, as a doctor, I told you that primary care physicians should talk about the fatty liver. Second, there are like FIB-4 score, which is easily calculated by the doctor. So they write it. Now, we as a diabetologist, endocrinologist, or metabolic physician, or you can call them obesity consultant, we specifically talk about liver, and we ask them patient also for this scan, which is also can be done just to understand that how much they have the fatty liver or how much they have inflammation in their liver. And then we talk about there are therapies which are available. It also, the weight reduction will also help them. And if you talk to the patient, I think they understand the importance of it and they start working on this. Mostly it used to, people used to think it is the alcohol which is responsible for liver problem. And if you just ask them, my liver reports are normal, then they will feel, oh, everything is fine. Well, that's not true, because there are other ways by which we can know it. And it is not just related with alcohol only, it is also because of the fats.
So, are there any specific diet or exercises that one can do, and how long would it take to see improvements?
So for metabolic health to improve, the diet is for Indian, it's high protein diet, more of fibers, low or I mean less direct or refined carbs. It should be more of a complex carbohydrate.
Right.
And overall fat, particularly fried fat, is to be decreased. The saturated fat is to be decreased, and definitely it improves. But exercise. One is regular physical exercise, which is physical activity to become more physically active, going for regular walk, aerobics, but muscle strengthening that helps. And then regular some exercise related to abdomen only. That's abdomen stretching, yoga, doing some abs. That will also improve the fatty health, liver.
New insight for me.
So that also we wanted to ask the patient to do it all these things regularly on regular basis, and we get the report again. If there is an improvement, they get definitely they convince to do it regularly. As I told you, there are medication which also helps for the inflammation part. So early inflammation can also be reduced by giving these medication.
Ma'am, I'd like to ask you that some people think that, diabetes, if you happen to have diabetes, it is going to stay lifelong with you. How true is that? So that is very important because when we talk about diabetes, we know that patients, if they lose weight, if they follow lifestyle modification, if they exercise, and all these things are done, and the weight loss is counted in percentages, like we say, patient who is 5%, 10%, 15, 20% weight loss. So when the patient loses weight over a period of time, the insulin resistance comes down. And there are patients who may have, we don't say that the diabetes is gone, we say that it has gone into remission or under control. So these patients may do well without medications also, but the important thing is they need to follow the lifestyle, continue doing what they have been doing and maintain the weight. Because if they regain the weight, the diet control is not done, the exercise is not there, the diabetes will come back. So it doesn't mean that the diabetes is gone forever. It is just under control, maybe without medications, but with lifestyle, with weight loss, and the follow up is important because these patients may also develop diabetes complications, and these patients need to be followed up regularly, like we follow our type 2 diabetes patients. And similarly, when the diabetes goes under control or into partial or total remission, these patients may also have fatty liver, which becomes better and may also become normal. And again, these patients again need follow up and they need to maintain the weight, follow the diet, and do the exercise as advised.
The important part is that complete metabolic health can be reversed, whether with medication, without medication, with lifestyle, and with intensive lifestyle. So this is a good news for the people with obesity, people with diabetes, people with fatty liver, that this can be reversed or at such a stage where you can reach where, many of these factors can be controlled. Maybe few medication can be continued or lifestyle modification itself is a medication. So they have to continue with the doctors on a regular follow-up.
Sir, I'm getting greedy, but I know we need to end this, but I want to ask you one last question. What are three practical tips that you would want to give to patients who are dealing with diabetes that will help them deal with their fatty liver in their everyday life?
So three things if I have to say. One, we should become more physically active. Now this is for everyone, whether you are a diabetes, non-diabetes, you are lean or you are obese, just to prevent from yourself to become a patient of a diabetes or a metabolic syndrome. That's number one. Second, overall Indian, if you see, our protein intake in our diet is less. So if second, as a mass, if I want to give a message, then I think we all should increase our protein intake. So whenever you see food, first see where is my protein. And that's what our ancestor has asked, dal bhat or dal roti. It's never roti dal or never roti bhat. So it is always a dal first and then roti. So that is also very, very important. So the second part. And third is just measure your abdominal girth. If your abdominal girth is more than half of your height, it means you are at a higher risk of developing all metabolic issues, which may be diabetes, cardiovascular disease, diabetes. So if you ask me only these three things, I mean, for mass, these three tips are very important.
Thank you so much for joining the panel today, and your insights were really helpful, and I've learned a lot today for sure.
Thank you, Sapna.